What happens really in a rehabilitation center, and how is the whole recovery process? I mean, is there an end in the rehabilitation residential program, and is there a start to another program after that? I think we should throw light on those lines.
Absolutely. I think we are known for rehabilitation, and even after 28 years of being in various domains, spaces, super specialties of psychiatry, professionals and people, community, they recognize us for being the best rehab center. And that is certainly we are known for it, and we are best at that. There is no doubt about that. So in the rehab, first thing, when the individual enters into our rehab, the psychiatrist, they evaluate the physical health part of it, the biological part of it, to assess what amount and what kind of biological support, medical support that this individual needs. Some people might have severe withdrawals. This is what we call a detoxification, where the person is going through a phase where the body is reacting for not getting the substance that the body was used to earlier. So this individual is supported with certain medications for a shorter period of time, so that this phase can be as smooth and as comfortable as it can be. Because many individuals, this withdrawals itself becomes a primary reason for them to go back and again take alcohol. So we help them with that. Along with that, whatever the physical health issues this individual has will have to be recognized, addressed by those specialists. If it is liver-related issues, gastroenterologist. If it is more of other physical health issues, the general medicine specialists. Along with this, the psychiatrist will also look for the psychiatric reasons why this individual is taking alcohol. Is there an underlying depression? Is there an underlying mood disorder? Or is there an underlying other psychiatric conditions like maybe ADHD or various other reasons? Or because of taking alcohol, has this individual developed any psychiatric comorbid conditions? Unless we address both, there is never a solution. That is the first part of it. Second, a clinical psychologist and the counselors address the individual psychological domain, trying to understand who this person is. Okay. So this is something which has been the philosophy, that one is the problem. The label is alcoholism. The label is alcohol dependence syndrome. But there is an individual who is going through this problem. And there is a person who is having this problem. And who is that person who is going through that problem? That becomes very, very important. For an example, if somebody has headache is common, but a coffee relieves headache for somebody, paracetamol relieves for somebody, sleep relieves somebody, because the individual who is going through the problem is different there, though headache is the common thing. So how the body responds, how the person is looking at the problem becomes extremely important, and that is the domain that the clinical psychologists and counselors look at it. They help him in looking at their coping strategies. It could be the cues management. It could be, the cognitive behavior therapies. If the person is in a denial that I do not have any problem, if I want to leave this alcohol, I can leave it, then there are therapies like, motivational enhancement therapy, or initially the motivational interview. There are a lot of, evidence-based psychological interventions that are available. Whatever is relevant and suitable to that particular individual, those therapies are picked, and those therapies are, administered or supported to that particular individual, both by counselor and clinical psychologist. Along with this, in alcohol-related issues, one of the important effects that an individual will have is when their own peers, people who take this alcohol, if he interacts with them, tries to understand what they have gone through and how they are perceiving the problem, if this person understands, the impact would be much more. So we have evidence-based group interventions, which are again conducted by the specialists. It can be as diverse as a psychoeducation group where we are talking about helping the individual understand what this alcoholism is, alcohol problems are, what are the complications, physical health issues, other issues that this alcohol can cause. That's one. Two, a very focused and expressive group or a cognitive behavior group or a mindfulness based interventions group. This is the second part that happens in the psychological domain, which is again structured during their stay in a residential rehabilitation. While medical issues are taken care by the psychiatrist, the psychological part is addressed at an individual level. Second, at the group level, the person is also encouraged to have good lifestyle, right, changes in the lifestyle, be it yoga, be it, spending time in the fitness where we have a gym, or it could be spending time, going around the center, walking track, walking, or games, playing outdoor games or indoor games where the person explores alternate pleasurable activities. He recognizes that it's alcohol, just not the alcohol which can give me the pleasure. There are many other things in life which I need to explore. So that's the other thing that will be happening. When this is happening, this journey is happening, the psychiatric social workers gets involved in assessing the family structure, interpersonal issues that this person is having, and those domains are also looked into and supported with.